Hello, my name is Steve Henniges, and I'm the Senior Vice President for Global Marketing and Clinical Development at Viking Systems. We are committed to becoming a worldwide leader in bringing integrated solutions to the surgical environment in the areas of information, visualization, and surgical instrumentation through both internal development and acquisitions. We are helping to create and deliver products that significantly enhance the surgical team's capabilities and performance in complex, minimally invasive surgical procedures that will improve the lives of patients through superior clinical outcomes.
Explore applications of technology in medicine. See how experts prevent, diagnose, and treat today's most traumatic illnesses. Discover the latest breakthroughs in healthcare on World Business Review's Health Journal Television.
Welcome to Health Journal Television. I'm Norman Schwarzkopf. Millions of Americans have surgery each year. Now, new 3D technology is helping provide patients with improved results and faster recovery times. Joining us for this discussion is Stephen Henniges, Senior Vice President of Global Marketing and Clinical Development for Viking Systems. Welcome, Steve.
General, it's an honor to be here. Thank you.
Also joining us today is Jordan Goodman, our in-studio correspondent. Welcome, Jordan. It's always great to have you.
Great to be with you again, General.
How do minimally invasive surgical procedures help patients requiring surgery?
Well, in a big way. In the old days, they would open up a patient and it would cost a lot. It would take like 6 weeks to recover. Now they do what's called keyhole, where they do maybe 4 or 5 small incisions. In many cases, the patient can go back the next day or soon thereafter. So it's going to be less time away from work. It's much easier to recover from. It costs a lot less. This is the way surgery is going today, is minimally invasive.
Steve, how is Viking Systems helping with these surgical procedures?
Well, at Viking Systems, we make a camera system that looks inside the patient's anatomy. And in the past, it's always provided the surgeon with a 2-dimensional view. With our technology, we offer the surgeon a 3-dimensional view so that they can naturally restore their depth perception, and it's done via a personal head display that the surgeon wears.
For more, let's go to this Health Journal Television field report.
Most surgeries performed with minimally invasive procedures require surgeons to operate in a limiting 2-dimensional environment. 3D vision restores the surgeon's natural environment, allowing more complex procedures to be converted to MIS procedures, reducing patient recovery time and cost to the healthcare community.
3D gives the surgeon a substantial advantage to appreciate the subtle relationships between the most important structures in the male pelvis. So when we're doing a radical prostatectomy, it's crucial for us to be able to identify the edge of the prostate, the nerves that are responsible for erections, muscles that are responsible for urinary control, and the surface of the rectum. And the 3-dimensional camera gives you an unparalleled ability to appreciate the nuances and the slight variations that can occur. And consequently, this allows the surgeon to do a much better job.
Instant access of critical patient data on command to surgeons, such as diagnostic images and video, streams directly into their field of view while operating.
It's better for the patients because they achieve a better functional outcome as a result of the operation. So they're much more likely to regain good urinary control quickly and to regain good erectile function quickly.
Newly announced 3D high-definition personal head displays provide improved resolution while being smaller, lighter, and more comfortable for surgeons to wear.
When you couple improved visualization, as we get with 3-dimensional cameras, with better surgical tools, I think one could predict that the outcomes of minimally invasive surgery would steadily improve.
Benefiting both surgeons and patients alike, Viking's 3D system takes this technology to the next level. For Health Journal Television, I'm Michael Clark reporting.
Steve, what was the driving force behind the development of 3D vision?
Well, the derivation of the personal head display actually came from military applications used to assist fighter pilots. We've since taken that technology and provided it to the surgical team, specifically making enhancements that provide it for minimally invasive surgery.
Well, how does your new 3D vision compare to older 2D technology?
Well, it's a great question. The older 2D technology, a surgeon has to learn minimally invasive techniques that trying to operate in a 2D vision. It would be like closing one eye and trying to perform a surgical procedure. With 3D, you get your natural depth perception restored, and especially as the surgeon and the surgical team are working around critical anatomy, they know where that anatomy is before they touch it or grasp it or suture it.
Well, how is this new technology helping surgeons perform more complex procedures?
Well, because it makes it easier for surgeons to perform the procedures, they can now move and do more complex procedures, having that depth perception restored.
How does this tool affect the training of surgeons?
The surgeon training is very, very minimal. And that is because it's normal. We see every day in 3D and we take it for granted. Surgeons that have had to learn minimally invasive techniques have had to go through a long learning curve to do it in 2D. So the training is minimal. They learn the procedure. They already know the procedures. With our technology, they simply wear the personal head display and now perform that as opposed to looking at a distant monitor.
I see how this benefits the patient. But how does this also help the hospital contain costs?
Good question, and that's obviously at the forefront of many hospitals today, is containing costs. With our technology, it allows the surgeon and the surgical team to perform the procedure much faster. So that helps to reduce the operating room time, which is quite expensive in most hospitals.
Steve, do you feel that your solution is helpful in attracting top surgeons to a healthcare facility?
The hospital is no question about it. It's a very competitive environment, and they obviously want to offer the latest technologies to make sure that they retain the top surgeons and attract new surgeons. Our technologies allow them to do that, and it's a popular marketing tool. Surgeons, certainly, if they're using our 3D technology at one hospital, does not want to have to take a step backwards and not have that capability at another hospital.
Probably once they've done 3D, they never want to do 2D again, right?
It's difficult to go back, yes.
Now, apparently, the kind of competition to your technology is robotic surgery. How does the 3D technology you have compare with robotic surgery?
Well, robotic surgery, the surgeon sits at a console away from the patient. With our technology, the surgeon remains at the patient using the instruments. So the similarity is actually that the robotic technology is the only other technology that offers 3D vision. Okay? In addition to that, robotic uses robotic arms that go into the patient body that the surgeon controls with his fingertips. The limitation around that is the surgeon no longer has their tactile feedback. With our technology, the surgeon is at the patient, and consequently, they maintain that haptic feedback. Probably one of the biggest differences, however, is our cost is about a tenth of what it is to get a robot.
Steve, thank you very much for this really interesting conversation we've been having. I look forward to the future now.
Thank you, General.
And Jordan, thank you for being here. You always add a lot to the program.
Thanks so much, General. Appreciate it.
And thank you for watching. Until next time, for Health Journal Television, I'm Norman Schwarzkopf.